Have questions about cannabis? More and more of these signs are popping up in front of pharmacies across Canada since cannabis' legalization. Maybe you've seen one outside your local pharmacy. Seeing these signs had me thinking, can we really answer people's questions about cannabinoids as a therapy? One of the main reasons why clinicians are so hesitant to include cannabinoids as part of a treatment plan is we really don't have the mechanistic evidence for how they work. So no, as of right now, we can't answer patients' questions. But that's not stopping numerous Canadians from turning to cannabinoids without the proper evidence for how they work and perhaps without the full support of their healthcare providers. So here's where I come in. My research focuses on whether cannabinoids can treat pain. More specifically, I'm interested in inflammatory bowel disease, which encompasses Crohn's disease and ulcerative colitis. These debilitating conditions are characterized by chronic inflammation of the gastrointestinal tract, where over 70% of patients experience daily excruciating pain. Traditionally, this pain is managed by opioids, but as we know, they're accompanied by severe adverse side effects and have led to an opioid epidemic across the globe. So could cannabinoids be a new alternative to opioids? In fact, many patients with IBD have tried or are continuing to use cannabinoids to manage their pain, and some do report symptom relief. However, we really aren't sure how this is working and if cannabinoids can actually target at the level of the gut. So to study this, I take the colon from a mouse with the arteries and nerves still attached. From there, I isolate a bundle of pain-sensing nerves, and in real time, I'm able to look at the nerve's activity in response to a painful stimulus, represented by those green spikes. Using this technique, I can look at the nerve activity before and after I apply a drug, and I can also see if that nerve activity recovers over time. Cannabinoids act via the type 1 receptor or the type 2 receptor, and what I found is when we use a drug that specifically targets the type 1 receptor, we can significantly reduce the nerve's activity, which suggests that there's less pain. In contrast, using a type 2 receptor specific drug, there is no change in nerve activity and thus no change in pain. This is extremely exciting because we now have some evidence that cannabinoids can actually act directly at the colon. But more importantly, this shows the potential for us to design specific cannabinoid-based therapies that target directly at these type 1 receptors on pain-sensing nerves, and potentially reducing the off-target side effects associated with cannabis use. At the end of the day, the goal of my research is to gather evidence to help answer patients' questions about cannabinoids and help them and their healthcare providers come up with a safe and informed treatment plan. And who knows, maybe one day you'll see my face outside your local pharmacy. Thank you.